Very, very good evening to all. And dear Shabazz, today my talk on our series, educational series for the patient, is on the male infertility, where many people they ask actually what is the definition of male infertility, because we should know what is the count and what is the motility. Basically, there are certain criteria which has been set by the WHO in 2010, when it described the concentration should be 10 million, 14 million per ml, 14 million per ml, and the total motility should not be less than 34%, and the normal morphology should not be less than 4%. Many times, patient they come, the male patient, with a semen count of 20 million. As per the criteria which has been set, it is normal. 20 million we consider normal, but 14 million per ml with a 34% of the total motility, with a 4% of normal morphology, this is considered to be a normal semen analysis. As far as the percentage of the male infertility is concerned, if we consider that about 11 to 15% is the prevalence of the infertility in the public and in the society amongst our people globally and also Indian patients, 1/3 it's attributed to male factor and 1/3 is only the wife is responsible, and 30 to 35% both will be responsible. You can just approximately calculate. Amongst all these men with infertility, which is 30% of the total infertile population, approximately 12% are having total azoospermia, means they do not have any sperm in their semen analysis and they are considered azoospermia. To have a cup formation of azoospermia, we have to have at least 2 samples 6 weeks apart. Apart from that, in this azoospermia patient, there are 2 categories, which is obstructive azoospermia and non-obstructive azoospermia, which will be giving us final diagnosis based on the testicular biopsy report. There are also a category of the male patient which they have sexual dysfunction, which either they are impotent, they don't have basically a intercourse and the relationship with their wife because they have a problem with the erection or ejaculation, or they have a retrograde ejaculation, which for these surgical things they have to consult a urologist or a sex therapist. As far as our responsibility is concerned, as an IVF and ART specialist, we deal with these patients which they are having oligospermia less than 14 million per ml, where either they have a mild oligospermia or basically severe oligospermia, they have a less than 5 million per ml. And mild oligospermia, they will be benefited from maybe 4 or 5 cycles of the intrauterine insemination, which is good success rate, around 15 to 20% success rate is there per each cycle. I won't go into the details for today's session. And if they are having a severe oligospermia less than 5 million, with the motility also is being affected, they are the category of patient which they have to go for ICSI, intracytoplasmic sperm injection. Patient with the azoospermia also same. They have to go for the testicular biopsy, TESI, or intracytoplasmic injection, where it is a micro injection. The injection of the sperm oocytes. This is one thing which is given very good fertilization rate of 90 to 95%, and a very good success rate, approximately 50 to 60% success rate is there, depends on the wife oocyte. If the wife, for other category of the sexual dysfunction, if they have a retrograde ejaculation, that is also there's a procedure and preparation of the semen. or if they have a sexual dysfunction, then they have to consult a urologist, and urologist will obtain the sample by electric ejaculation, and then they will send the sample to us, and we process the sample and we do the IUI. And as far as the other things are concerned, like basically the impotence, again, they need to see a sex therapist or a urologist and andrologist, and with the same basically the procedure of obtaining the semen, ejaculated semen, then will be handed over to us, and then we perform the IUI. Which IUI, each cycle has got a 10 to 15%, and the cumulative success, which about 5 to 6 times once we do, it will go to 60-70%, which is a very good success. It's a non-invasive with a good success rate, provided the age of the wife is not on the higher side, and she is also got not other factor like of the other pathology like endometriosis or any other ovulatory disorder. Only male factor, then we can get a very good success in IUI itself. I advise all of you, if you are having any problem which is in relation to your husband problem, either impotence or lack of the relationship between both of you, or is a can't is a problem, or he's got an asthma sperm, don't feel delicate, don't feel shy, is something which is very common in our day-to-day treatment with the infertile patient. And I advise you, please contact and the number which is being given by our Mr. Shabazz. Please contact the same number, and you are most welcome, and you will get the best treatment. Thank you very much.